It's Tuesday, April 14th, and I'm Trish Gardner, Public Health Officer for the City of Great Falls and Cascade County. When the CDC recently confirmed that COVID-19 virus can live on surfaces that have been contaminated with droplets, many people began to wonder whether the food supply was still safe. At this time, the FDA states that there is no evidence to suggest that food produced in the U.S. or imported from countries affected by COVID-19 can transmit the virus. Furthermore, there is currently no evidence of COVID-19 being transmitted by food or food packaging. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. Foodborne gastrointestinal, or GI viruses, like norovirus and hepatitis A, often make people ill through contaminated food. However, COVID-19 is a virus that causes respiratory illness, not GI illness. So foodborne exposure to this virus is not known to be a route of transmission. For these reasons, the FDA does not anticipate that food products will need to be recalled or withdrawn from the market for reasons related to this outbreak. Even if a person who works in human or animal food facility, like food packager, is confirmed to be positive for the COVID-19 virus. Likewise, you are unlikely to acquire COVID-19 from food handled by an infected worker, but that food worker could certainly spread the virus to another person. If you are sick, no matter where you work, stay home until you are better and no longer pose a risk of infecting others. Anyone handling, preparing, and serving food should always follow safe food handling procedures, such as washing hands and surfaces often. It's also critical to follow the 4 key steps of food safety: clean, separate, cook, and chill. This also prevents the likelihood of spreading COVID-19. If you are concerned that your food or food packaging could be contaminated, then do the following. Wash your hands after handling food packaging. Wash your hands after removing food from the packaging. Wash your hands before you prepare food for eating, and wash your hands before you eat. Frequently clean and disinfect any contaminated surfaces in your home and kitchen. Experts at Harvard School of Public Health state that if you wish to, out of abundance of caution, you can carefully wash frequently touched plastic food packaging, like milk containers, with a little soap and water, but be sure to wash your hands afterwards. Despite rumors to the contrary online, there is no need to wash fresh produce using soap, bleach, or other household cleaners. In fact, the FDA warns that this practice could be very harmful because these cleaners are not food safe and may have additives that are not intended for human consumption. In order to prepare fruits and vegetables for consumption, begin with clean hands. Wash your hands for at least 20 seconds with soap and warm water before and after preparation. Cut away any damaged or bruised areas on fresh fruits and vegetables before preparing and/or eating. Throw away any produce that looks rotten. Wash all produce thoroughly under running water before preparing and/or eating, including produce grown at home or bought from a grocery store or farmer's market. Again, washing fruits and vegetables with soap, detergent, bleach, or commercial produce wash is not recommended. Even if you do not plan to eat the skin, it is still important to wash produce first so that dirt and bacteria are not transferred from the surface when peeling or cutting produce. Scrub firm produce such as melons and cucumbers with a clean produce brush. After washing, dry produce with a clean cloth towel or paper towel to further reduce bacteria that may be present on the surface. For food establishments that are providing takeout or curbside service, the CDC recommends routine cleaning of all frequently touched surfaces in the workplaces, such as workstations, countertops, and doorknobs. Using the cleaning agents that are usually used in these areas and follow the directions on the label. CDC does not recommend any additional disinfection beyond routine cleaning at this time. Know that restaurants and retail food establishments are regulated at the Montana State and at the local level. State, local, and tribal regulators use the food code published by the FDA to develop or update their own food safety rules. At all times, local licensed food establishments are required to maintain clean facilities, including clean and sanitized food contact surfaces, and have food safety plans in place. Food safety plans include a hazards analysis and risk-based preventive controls, and include procedures for maintaining clean and sanitized facilities and food contact surfaces. Like other work establishments, food facilities need to follow guidance set by local and state health departments, which in Cascade County are determined by Governor Bullock's directives and health officer orders. If you have any questions about what your business should do to lessen the risk of COVID-19, please reach out to CCHD. If you are a community member and see situations that cause you concern, please call or email us to submit a complaint, and we will have a CCHD employee investigate. As usual, we'll update our Facebook page later this evening with number of cases in Cascade County. Please call us with any concerns or questions at 406-454-6950 or email CCHD at health@cascadecountymt.gov. Stay home, stay safe.